Welcome to AFD TV. I'm Dr. Steve Semidrala here with Nurse Sonia and Gokul with CareHarmony. So, what is CareHarmony?
So CareHarmony is really a support program for patients, their families, and also their caregivers. And really what it does for patients, it helps them have personalized one-on-one help in between their doctor's appointments. We're always really excited about what we're doing here and how we can extend AFD's awesome care outside of the doctor's office.
Okay, great. How can CareHarmony help our patients?
Well, the main goal of the program is to help patients in whatever way will benefit them the most. Coordinators are a big plus. Each patient gets their own coordinator. Coordinators get to know the patients and care for them as their own family members. Patients also find comfort in speaking with the same person each month and call them at any time. Support line is also available for these patients 24/7.
So you're a coordinator?
Yes, sir, I am.
And so what happens when they call after hours?
They always have someone available to them to call.
Oh, so you're on call sometimes?
Yes, always.
Okay. And then how many calls do you normally get after hours?
It just depends on the circumstance. Sometimes it can be one a month, sometimes it can be twice a week.
Oh, okay, wonderful. Yeah. So it's pretty rare, and because most things are non-urgent, and
Yeah.
you're able to help people.
Yeah, but we always encourage them to call if there's any needs.
Great.
And patients can also get help they need to improve their medical conditions, such as high blood pressure, diabetes, arthritis, and other conditions. This could be by goal setting, helping them track their goals, and also learning other ways to better manage their care at home. Coordinators also connect patients to resources within their communities to help them with struggles they may be experiencing due to limited income. For example, we assist patients with cutting their medication costs, getting utility assistance, finding food pantries and community closets, and much more. We get to know you and the needs first.
Awesome. So why do patients join CareHarmony?
They join for a lot of reasons. Some people just need to talk to someone. Some other reasons our patients join are getting assistance with stress of handling multiple conditions, still having questions answered after leaving their doctor's appointments, or forgetting that they have questions and then wanting someone to kind of reassure them after their appointments. Some may not understand their medication, so we're an extra support for that as well. They may be unaware of restrictions they have in regards to their diet, help them keep track of their appointments, so that could be routine or follow-up appointments and annual exams. And just having that extra support person to be a person of contact.
That's wonderful. And so, no, I think these are great things. And I guess, and you're the founder of CareHarmony.
That's right.
Yeah, so why'd you decide to start CareHarmony?
Well, that's a really great question, Dr. Sam. I think there's just a lot of patients out there that have a lot of needs. And, if you look at it, typically your doctor's appointment, you're in there, you may be in there for a half an hour. But when you look at the time of the month, 99% of the time you're probably in your own home. And you do have a lot of other needs, and you may have questions that pop up while you're at home, or have a lot of other things that are involved with staying healthy, especially when you have some of these chronic conditions like diabetes, COPD, asthma, heart failure. So what I saw was a real opportunity to help people, and I think that's what our team at CareHarmony is really passionate about doing, is finding ways that we can help our patients and make sure they get all the support they need in their own home so they can stay as healthy and happy for as long as possible.
Wonderful. And what insurances do you guys take?
Right now we're taking Medicare, of course, and also we take about 10 care patients as well.
And some Medicare Advantage as well, too?
Yes, Medicare Advantage as well. Yeah, as many patients as we can, we try to help, yeah. And if there's anything unclear, we'll find out and make sure that we can provide services before we start. So
wonderful. And so it helps with even patients who are disabled, younger patients, Medicaid patients, pediatric patients.
Yeah.
Yes.
Yeah.
Sonia, I think you have a lot of disabled patients, don't you?
Yeah, right now we do. We like to help them with any type of assistive devices they need, or any type of strains they have in regards to their finances, with covering the things that they need at the moment.
especially when we talk to patients especially with family members of disabled families, and there's a lot of caregiver stress, and we talk to them about CareHarmony. They're very excited because they feel like not only is the patient being cared for, but the family members, the caregivers are being cared for too. So, well, thank you for everything you do.
Oh, thank you.
Thank you for everything you do.
And just real quick, in terms of signing up for patients that are interested, it's really easy. You can obviously go by AFD, and when you're at your appointment, you can ask for a form, and you can fill that out and sign up. And then starting next year in 2017, there's some exciting changes. You can actually sign up online through the website at www.care-harmony.com/AFD. Or you can just call us directly at 629-888-9202, and a coordinator like Sonia will pick up the phone, and you can enroll through the phone too.
Oh, wonderful. Thank you so much.
Right.
And thank you for watching AFD TV.
Thanks.
See you next time.
AFD TV is designed to provide an educational discussion about current medical topics. For a personalized medical opinion, please consult your primary care physician or visit one of America's Family Doctors clinics today.